Welcome back. You're trying to stay healthy, right? But what can you do to boost your body's power to fight off infection? Is there something? We'll break down some of the things you can do to stay healthy.
Plus, what are hospitals doing to keep you safe? Dr. Nicholas Testa is the Chief Medical Officer for Dignity Health Southern California, and he joins us now. Happy Friday to you. Thanks for being with us. It is more... Of course, always a pleasure to see you. It is more important than ever for people to keep their immune systems healthy. What are some things that people can do?
So the literature right now is rich with the impact of being in quarantine. And what we're seeing is this. People are gaining weight. That's the number one thing we're seeing. And the key thing right now is we got to be conscientious of what we're putting in our body while we're in quarantine. And then we've got to be conscientious of how we're exercising. And there's a couple of very specific trends that we're seeing. Firstly, sleep habits. People are showing poor sleep habits during quarantine. The other one is there's a lot of snacking going on, particularly after dinner. And then we are also seeing a decrease in exercise. So we've got to get out and exercise. It's really the basic stuff that we've always known that we need to do. Unfortunately, quarantine has allowed us to slip into some pretty bad habits.
And it doesn't hurt just to be outside. Get that sunshine on your body. Get yourself exercising. Okay. Now,
100%.
Yeah, and people are still having surgery. I mean, we still have people going to the hospitals. Family member is about to have a knee replacement. Okay, what can you do to get into the hospital? And then what about people who want to go see or visit a patient who's had surgery?
Yeah, so for patients who are going to have surgery, you got to follow the hospital and your doctor's directions. The key thing is that we are testing every patient preoperatively for COVID-19. And that in itself has really allowed us to control the population that's coming in. There's a lot of stuff going on in the background that you'll never see. The other key thing is that you got to follow the directions that relate to visitors. We have loosened some of it, so we're having more visitors in the hospital, but we're still really controlling the visitors. So you've got to accept that when you go to get that surgery or have that loved one that's going.
Yeah. And what's your take on a new study that shows delays in colorectal cancer screenings due to the pandemic, and also similar findings in regards to breast cancer that could lead to higher rates for advanced stage cancer cases? Any thoughts on that?
You know, Giovanna, this comes back to the first thing we talked about, which is how are we taking care of ourselves during quarantine? Initially, when COVID-19 struck, we really shut down a lot of our elective procedures like colon cancer screening or mammography. Well, that's all back up and we're doing it regularly. Now patients need to come in to do those things. There's been really quite a few shocking studies that are coming out. One from a large cancer group internationally that showed initial breast cancer cases that were identified in 2019, about 12% on initial identification were advanced or metastatic. We're now seeing those rates up to 18%. So there's clearly an impact to this delay. So just like we have to be taking care of ourselves from what we put in our body and how we exercise, we got to get back to doing those just regular health maintenance routine.
Yeah, really good information for people to take note of. Thank you so much, Dr. Testa, for joining us. Enjoy your weekend.
Thanks, guys. You have a great weekend.